A lot of people over 60 take painkillers almost every day. Maybe it's for a stiff knee, a sore back, or even just a headache that won't go away. Curious. It seems harmless, right? You pop a pill and the pain fades. But here's the thing. Some of these pills can quietly affect your heart without you even realizing it. I'm not talking about something obvious like chest pain or shortness of breath. I'm talking about hidden stress on your blood vessels, your heart, and your blood pressure. Size. It's sneaky, and it can build up over months or years. Take anti-inflammatory drugs, for example. These are the ones people often use for arthritis or joint pain. They help reduce swelling, and they make movement easier. That's great. But the problem is, they can also make your blood vessels tighten and your blood pressure go up. When your blood pressure rises, your heart has to work harder. Imagine carrying a heavy backpack all day, every day. Over time, your heart gets tired, and the risk of problems like heart attack or stroke grows. The scary part is that your body might not give you a clear warning. You could feel fine one day and then suddenly face a serious heart event. Some people think, I'll just take the lowest dose so it won't hurt me. But even small doses, if taken regularly for months or years, can slowly change how your heart and blood vessels behave. And if you already have high blood pressure, diabetes, or a history of heart problems, the risk is even higher. It's like adding fuel to a fire you can't see. Another thing is that these pills can affect your kidneys. Your kidneys help manage fluids and salts in your body. When they don't work properly, fluid can build up. That extra fluid makes your heart pump harder and your blood vessels feel more pressure. It's a chain reaction. One pill for pain might lead to higher blood pressure, extra strain on your heart, and over time, more risk of serious events like stroke. Now, don't get me wrong. I'm not saying stop taking your painkillers. Pain is real, and it affects your quality of life. But the key is awareness. Know what you're taking, how often, and what your body is telling you. Some people mix painkillers without realizing they contain similar ingredients, which can double the effect on blood pressure. Others keep taking them for months without checking in with their doctor or pharmacist. That's when problems quietly start to creep in. It's also worth noting that some people take these pills thinking they are harmless because they're common or available over the counter. Just because you can buy them without a prescription doesn't mean they are completely safe for everyone, especially if you are over 60. Your body changes as you age. Your heart, blood vessels, and kidneys don't handle stress the way they used to. Even small things that were fine in your 40s or 50s can start to have big effects after 60. One simple step is to check your blood pressure regularly. If it's creeping up, it might be related to the medication you're taking. Another step is to talk to your doctor or pharmacist before starting a new painkiller. Ask about long-term effects, alternative options, and safer ways to manage pain. Sometimes, lifestyle adjustments like gentle exercise, stretching, or hot and cold therapy can reduce pain without putting extra stress on your heart. It's also important to watch for subtle signs. Maybe you notice shortness of breath when climbing stairs, or your ankles swell slightly at night. These can be early hints that your heart is working harder than it should. Don't ignore them. Early action can prevent serious problems later. The truth is, these painkillers can be life-changing for your comfort, but they can also be life-changing in a dangerous way if we're not careful. Awareness, small adjustments, and regular monitoring are your best defenses. You don't have to give up your pain relief, but you do need to be smart about it. Take the time to understand your medications and how they affect your body, especially your heart. Your heart is not something to gamble with. One small pill might seem harmless today, but over time, it can quietly increase your risk. The choice isn't between pain and health. It's about managing both wisely and safely. Be aware, watch your heart, and make sure the pills you take for comfort don't end up causing harm in the long run. A lot of people over 60 deal with heartburn or acid reflux. It's uncomfortable, sometimes even painful. So naturally, many reach for pills that promise fast relief. These medicines can help your stomach feel better quickly, and that's why they are so popular. But there's a side of them that most people don't think about. Long-term use of these pills can quietly affect your heart and overall health in ways you might not notice until it's serious. These medicines work by reducing the acid in your stomach. That seems harmless, right? But stomach acid isn't just there to cause discomfort. It helps your body absorb important minerals like magnesium, calcium, and zinc. Over time, if your stomach acid is constantly low, your body can struggle to get enough of these nutrients. Magnesium, for example, is essential for your heart rhythm. Without enough magnesium, your heart can develop irregular beats. Sometimes it's subtle, like feeling a flutter or extra beat, but other times it can trigger serious problems like a heart attack or stroke. People often take these pills daily for months, even years. They may think, it's just a stomach pill. How can it hurt my heart? The truth is, it's not about immediate danger. It's about slow, invisible changes that happen inside your body. Your heart rhythm, blood pressure, and even your nerve function can all be affected without you realizing it. And if you already have other conditions, like high blood pressure or diabetes, these hidden effects can pile on top of each other, making your heart even more vulnerable. Another thing many don't realize is that these pills can affect how your body handles medications you take for other conditions. Some heart medicines, for example, need proper levels of minerals like magnesium to work effectively. If your acid reducing pill is lowering magnesium levels, your heart medicine may not do its job as well, leaving your heart exposed to extra risk. It's like trying to drive a car with low tire pressure. You might get where you need to go, but you're more likely to run into trouble along the way. There's also the issue of infections. Long-term use of acid-reducing pills can make it easier for bacteria to grow in your stomach and intestines. While that might sound like a stomach problem, it can actually have effects on your heart and circulation too. Infections cause inflammation in the body, and chronic inflammation is a known factor for heart disease and stroke. So, even something that seems unrelated to the heart can quietly contribute to risk over time. Some people try to manage their symptoms by taking more than the recommended dose or mixing different acid-reducing medications. That can make the problem worse. It increases the chance of nutrient deficiencies and can even affect your kidneys. And when your kidneys aren't working properly, your heart has to work harder to pump blood, which raises the risk of serious events. You don't have to stop taking these pills if you need them, but you should be smart about it. Short-term use is generally safe, but long-term use needs supervision. Talk to your doctor about whether you need regular blood tests to check your magnesium and other minerals. Ask if there are safer alternatives, like changing your diet, eating smaller meals, avoiding trigger foods, or using other methods to control acid reflux. Sometimes small lifestyle adjustments can reduce your need for these pills while keeping your heart safer. It's also important to watch for subtle signs. Maybe you feel extra fatigue, slight dizziness, or occasional heart flutters. These might seem minor, but they can be early hints that your heart is affected by long-term changes in your body. Don't ignore these signs. Early recognition allows you to take action before things get serious. The key is awareness and balance. You want to feel comfortable and avoid stomach pain, but you also want to protect your heart. That means knowing what your medications are doing beyond the immediate relief they provide. It means checking in regularly with your doctor, monitoring your blood levels, and making adjustments when necessary. Your health isn't just about feeling okay today, it's about keeping your heart strong for the years ahead. These pills can make your stomach feel better, but they can also quietly increase risks you may not notice until it's too late. The goal isn't to fear them, it's to use them wisely. Watch your heart and make sure that comfort doesn't come at the cost of your long-term health. Be careful, be aware, and take steps to protect your heart while managing your stomach. A lot of people over 60 struggle with sleep. Nights can feel long, tossing and turning, waking up multiple times. It's frustrating. And when sleep doesn't come, many reach for sleeping pills. They seem like an easy solution. Pop one, drift off, and finally get a few hours of rest. But here's the thing. Some of these sleeping pills can affect your heart and your health in ways most people don't expect. These medications can slow down your breathing. At first, it might not be noticeable. You think you're just sleeping deeper, but your oxygen levels can drop without you realizing it. Low oxygen at night puts stress on your heart. It's like your heart is working harder than it should while you're trying to rest. Over time, that stress can increase the risk of serious problems like stroke or heart attack. Some sleeping pills also change how your nervous system works. They can make your heart beat irregularly. It might feel like a flutter or a skipped beat. Sometimes people dismiss it as nothing, but in older adults, irregular heartbeats can be dangerous. They can trigger clot formation in the heart, and those clots can travel to the brain or other parts of the body. That's how a simple pill for sleep can quietly increase the risk of stroke. Another concern is balance and coordination. Sleeping pills can make you drowsy the next morning, even if you slept for hours. For people over 60, this drowsiness can lead to falls. A fall may seem unrelated to the heart, but injuries, especially fractures, can lead to longer hospital stays, inactivity, and stress on the body. The heart has to work harder when the body is stressed or healing, which again increases risk. Many people don't realize that not all sleeping pills are the same. Some are stronger, some are weaker, some work in different ways. What's safe for one person might be risky for another. Age, existing heart problems, blood pressure, and other medications all affect how these pills act in the body. That's why it's dangerous to just take a sleeping pill without guidance, even if it's available over the counter or seems harmless. Some people take sleeping pills for months or years without a break. That can cause your body to become dependent on them. Your natural sleep cycle can get disrupted, making you need the pills more and more. The more you take, the higher the chance of side effects on the heart and circulation. It's a slow, quiet process, but it can have serious consequences if you're not paying attention. There are also subtle signs that something is off. Maybe you feel unusually tired during the day, or your heart races when you wake up. Maybe you notice swelling in your legs or slight dizziness. These are hints that the medication might be affecting your heart or circulation. Early attention can prevent bigger problems. Ignoring them is risky because heart issues in older adults often don't announce themselves loudly until it's too late. The good news is there are safer ways to improve sleep without putting your heart at risk. Simple things can make a big difference. Going to bed and waking up at the same time, keeping your bedroom dark and quiet, avoiding caffeine in the evening, gentle stretching before bed, these things help a lot. Even walking during the day can improve sleep quality at night. Sometimes, combining these habits with occasional short term use of sleeping aids is enough. You don't always need long term medication. It's also important to check with your doctor about the specific pills you are taking. There are newer options that are less likely to affect the heart, but you have to know which ones are safe for you. And never mix sleeping pills with alcohol or other sedatives. That combination can be dangerous, especially for older adults, because it increases the risk of breathing problems, falls, and heart stress. Sleep is essential, especially as we age. It affects your energy, your mood, and your heart. But using sleeping pills without awareness can quietly increase your heart risk. The goal isn't to stop sleep aids completely, it's to use them safely, wisely, and with guidance. Protect your heart while getting the rest you need. Your nights should restore you, not put your heart at risk. Be mindful, watch for subtle signs, and take steps that support both sleep and heart health. Many people over 60 take medications for diabetes, and that makes sense. Managing blood sugar is very important, but some of these diabetes pills can quietly affect your heart in ways most people don't think about. One of the main concerns is fluid retention. Certain diabetes medications can make your body hold on to extra water and salt. You might not notice it at first, but this extra fluid puts added pressure on your heart. Your heart has to work harder to pump blood, and over time, that strain can increase the risk of heart failure or other serious problems. It's easy to miss. You might notice your ankles swelling at the end of the day, or your shoes feel tighter than usual. Some people feel short of breath after climbing a few stairs, or notice fatigue that comes on faster than before. These might seem like small issues, but they're signs your heart is working harder than it should. Ignoring them can quietly lead to bigger problems. Some people assume that because a medication is prescribed for diabetes, it's automatically safe for the heart. But the truth is, every pill has side effects. Some diabetes medicines are great for controlling blood sugar, but if your heart is already struggling, the extra fluid retention can be risky. Your heart is like a pump. If it has to push more fluid than it's designed to handle, stress builds up over time. Even small, consistent stress can eventually trigger serious events, especially after 60. Another thing to watch for is weight gain. Fluid retention can make the scale go up, even if your diet hasn't changed. Some people think they are gaining fat or overeating, but it's really water. That added weight makes your heart work harder. Over time, it can affect blood pressure and circulation, creating a cycle that puts more strain on your heart. It's also important to consider other medications you might be taking. Sometimes diabetes medications interact with heart medications, blood pressure pills, or even over-the-counter medicines. These interactions can amplify fluid retention or affect how well your heart can handle stress. That's why it's so important to review all your medications regularly with your doctor or pharmacist. Even small adjustments can make a big difference for your heart health. Some people don't realize that lifestyle choices can help too. A balanced diet, limiting salt, staying active, and watching weight can reduce fluid buildup. Walking, gentle stretching, and staying hydrated in the right way can support your heart while controlling blood sugar. It's not just about the pill, it's about supporting your body so your heart isn't overworked. Many older adults feel frustrated because managing diabetes is already complicated. You have to check blood sugar, watch what you eat, and take multiple medications. It can feel overwhelming, but adding awareness about your heart and fluid retention doesn't have to be complicated. Simple things like daily weight checks, noticing swelling in ankles or hands, and reporting shortness of breath early can prevent bigger problems down the line. It's also worth noting that some people feel fine for years while taking these medications and then suddenly experience a heart issue. That's because fluid retention and heart strain can build up slowly. Your body adapts to small changes, but that doesn't mean there isn't hidden stress. Early recognition is key. Don't wait for symptoms to become severe. The goal isn't to stop taking diabetes medications. They are important for managing blood sugar and preventing complications from diabetes itself. The goal is to use them wisely, understand their effects, and take proactive steps to protect your heart. That means regular checkups, watching for subtle signs, and making lifestyle choices that support both your heart and your blood sugar. It's amazing how the body adapts, but we have to respect it. One small pill can help with diabetes, but quietly increase strain on the heart if we're not careful. Awareness, early action, and consistent monitoring make all the difference. Your heart is too important to leave to chance. Be mindful, watch your body, and support your heart while managing your diabetes. Some people over 60 take hormonal treatments. Sometimes it's for menopause, sometimes for other conditions. Hormones can help improve energy, mood, and overall well-being. But here's the thing. Certain hormone medications can increase the risk of blood clots, and blood clots are dangerous because they can travel to your heart or brain, causing a heart attack or stroke. The scary part is that you often don't feel anything until something serious happens. Blood clots form when the blood thickens or the flow slows down. Certain hormone treatments can make this more likely. You might feel fine for months while the clot is forming silently. Then, one day, a clot travels to a crucial place like your heart or brain, and suddenly you're in serious trouble. That's why this is a hidden risk many people don't talk about. Some people assume hormone therapy is only a concern for women. That's not true. Men can also take hormonal treatments for low testosterone, and the same risks apply. Blood clots can affect anyone, and older adults are more vulnerable because the circulatory system changes with age. Blood vessels become less flexible, and the heart has to work harder. Adding a medication that increases clot risk can quietly tip the balance toward danger. Another thing to understand is that the risk is higher if you have other health problems. High blood pressure, diabetes, heart disease, or previous clotting issues all make hormone therapy riskier. Even if you feel healthy, the combination of age and these medications can quietly increase your chance of a serious event. It's not something that happens immediately. It's a slow buildup that you may not notice. Some people take hormone pills thinking they are completely safe because they are prescribed. Prescription doesn't mean there's no risk. It means the doctor believes the benefits outweigh the risks for your specific situation. But even so, long-term use without monitoring can be dangerous. Regular checkups, blood tests, and knowing your family history are important. You have to be proactive. Signs of a clot can be subtle at first. You might feel unusual swelling in one leg, warmth, or redness. Sometimes there's slight pain in the chest or shortness of breath. Many dismiss these symptoms, thinking they are minor or related to something else. But in older adults, ignoring these early signs can be very risky. Early detection can prevent something catastrophic from happening. Lifestyle also plays a role. Staying active helps your blood circulate better, which reduces the chance of clots. Simple things like walking, stretching, and avoiding long periods of sitting can make a difference. Even small steps help because hormone treatments increase risk mainly when blood flow is slow or stagnant. Being proactive about movement keeps your blood flowing and your heart safer. It's also important to know that hormone medications are not one size fits all. Different types and doses carry different risks. Some forms are safer than others, and your doctor can help you find the best option. Don't just rely on what worked for someone else or what you read online. Your body and your heart health are unique. Some people think lifestyle changes alone can replace hormones. In certain cases, that might help, but for many, the medication is necessary. The key is balance. Use the treatment that improves quality of life, but take steps to reduce hidden risks. Monitor your body, know what signs to watch for, and keep your doctor informed. It's easy to focus on the benefits of hormone therapy, the energy, mood, and relief it provides, but it's equally important to focus on the silent risks. One small pill can change hormone levels and improve life, but it can also quietly increase your heart and clotting risk. Awareness, monitoring, and healthy habits are your shield. The goal isn't to avoid hormones entirely. The goal is to be smart about their use, to recognize early warning signs, and to support your heart while improving your quality of life. Your body gives you clues. Don't ignore them. Protecting your heart while taking care of yourself is not optional. It's essential. Be aware, move your body, and stay alert to subtle changes while using hormone treatments. A lot of people over 60 reach for simple cold or flu pills when they feel unwell. They think, it's just a cold, I need quick relief. And for many, these over the counter medicines do help with sneezing, congestion, and a runny nose. But some of these pills contain ingredients that can quietly affect your heart. They can tighten blood vessels, raise blood pressure, and increase your heart rate. For someone over 60, especially if they already have heart issues, this can be a hidden danger. It's easy to overlook because you feel fine while taking the medication. You think, I'm just fighting a cold. What harm can it do? But even a small increase in blood pressure or heart rate can put extra stress on the heart, especially when combined with other medications or conditions. Over time, that stress can make a heart attack or stroke more likely. It doesn't happen immediately, but it builds quietly, almost like a slow leak in a tire that eventually causes a blowout. Some people take multiple cold medicines at once without realizing they contain the same active ingredients. For example, two different pills might both have decongestants. Mixing them can double the effect on your blood pressure and heart rate. That's why it's so important to read labels carefully. Even medications that seem harmless can add up to something dangerous. Another concern is that cold medicines can interact with other medications you take for blood pressure, heart disease, or diabetes. These interactions can amplify the effect on your heart or circulation. A pill that might be safe on its own could become risky when combined with other medications. That's why checking with your doctor or pharmacist before taking anything new is so important, even if it's just a simple cold medicine. Sometimes the risk is subtle. You might notice a slight increase in heart rate, feel jittery, or have trouble sleeping after taking a decongestant. You might think it's just the cold itself, but it could be the medicine affecting your heart. Small changes like this matter, especially in older adults, because your heart may not handle stress as easily as it did when you were younger. People often focus on the immediate relief from cold symptoms, and that's understandable. Nobody wants to suffer with a stuffy nose or sore throat, but the long-term effects on your heart can be serious if you're not careful. Even occasional use can spike blood pressure temporarily, and repeated spikes over months or years can increase the risk of a heart attack or stroke. It's also worth noting that some cold medicines can cause dehydration. When you're dehydrated, your blood becomes thicker and your heart has to work harder to pump it. Combine that with the blood vessel tightening from some ingredients, and your heart is under extra stress. Simple things like drinking plenty of water and using other remedies like saline sprays or steam can reduce the need for heavy medicines. Some people think, it's just a short-term cold, I'll be fine. But even short-term spikes in blood pressure or heart stress can trigger serious events, especially if you have existing heart conditions or risk factors like high cholesterol, diabetes, or a family history of heart disease. That's why awareness is so important. You don't have to avoid cold medicine completely, but you need to be careful about which ones you use and how often. Reading labels, understanding ingredients, and paying attention to your body are key. If you notice swelling, dizziness, shortness of breath, or an unusually fast heartbeat, take it seriously. Don't dismiss it as just part of being sick. Early recognition of these subtle signs can prevent something more serious from happening. The main idea is that even common, over the counter medications can affect your heart, especially after 60. They can provide relief, but they also carry risks that are easy to overlook. You can still take them when necessary, but do it with awareness, moderation, and care. Combine them with safe habits like rest, hydration, and gentle movement to support your overall health. These cold medicines can make you feel better quickly, but they can also quietly increase stress on your heart. Protecting your heart while managing minor illnesses is just as important as treating the cold itself. Be careful, read labels, and pay attention to how your body reacts. Your heart deserves that attention.